Yoo-hoo!
Get 6 people.
Ready? I'm in charge now. According to social psychological research, people who lead workshops should establish themselves as experts, or you're not going to listen to us. So, interestingly enough, a lot of that has to do with how we look and how we sound. And since I'm not 6'4" and male with a deep voice, you're going to immediately dismiss me. Unless I prove to you that I know something of what I'm talking about. So I wrote a book about it, and and I taught this stuff for years and years and years. But I'm going to introduce these great guys. This is Francis Kaklauskas. He has a PsyD in clinical psych, 2008. He's on the core faculty of Naropa University. He has many refereed journal articles, book chapters, and books. He's a research consultant. He is an AGPA fellow with a lifetime contribution award. And given how young he is, compared to me and Les, that represents a lifetime of good works where there is plenty of life left to do more. He needs to learn to say no. What I love and admire most about Francis is the sensitivity of his self-scrutiny to always work towards being a better person without getting stuck in narcissistic solipsism, his willingness to risk, and his Zen gentleness. Now, I looked up Les on LinkedIn. He happens to be a lead singer for Patrick and the Swayzes. Oh, it's not you.
That's the other one.
He's on the clinical faculty and Department of Psychiatry at Yale. He earned his PhD at Yale. I mean, no small thing. I bet you noticed him as the past president of AGPA. He's a psychotherapist in private practice, senior staff psychologist, and I'm quoting Eileen Dublin because I completely agree with her. Les is a brilliant and creative researcher, former editor of the International Journal of Group Psychotherapy, innovator, leader, and member of psychotherapy and training groups, and important contributor to the American Group Psychotherapy Association, and my friend for many years. And this is a nice picture of him in case you don't recognize him. And I'm Sally Barlow. I'm a happily retired professor. I taught in the clinical psychology program, and I was the only woman in the psychology department for 15 years. And I learned a lot about sexism and diversity. And we all are trying to open up the power of groups to everyone, which means we have to be more than sensitive. We have to be really alert to each other's otherness. I've researched in groups all my life. It was my dissertation. I taught the group classes. But the award that means the most to me is I got my university's highest award in teaching excellence. I would rather teach than do anything else. And I am a reluctant researcher. The only reason I did research, I'm embarrassed to say, is because I wanted my male colleagues' approval so I could get advanced in rank. And I see some of my friends nodding. But it taught me a lot. It taught me to think in a different way. And I owe a lot to my colleague, Jerry Burlingame, who helped me with research design and methodology and statistics. So without further ado, let's.
Thank you, Sally. Actually, I should quit while I'm ahead. That was such a great introduction. Going to go downhill from here, I think. This is open session 305, integrating research and...
301.
This is open session 301, integrating research and theory. What every group clinician should know. The operative term in the title, it's not the number, whether it's 301 or 305, the operative term is integration. That's the central focus of this workshop because, as I said back in 2014 in my presidential talk here at AGPA, and what's still true today, is that clinicians and researchers don't speak the same language. The language of the clinician, of the therapist, aims at discovering small truths, knowledge, ideas, hypotheses that help to answer clinically relevant questions like, what intervention in this particular moment with this particular group or this particular patient will help move the group forward? The therapist wants understandings of the subtleties, the complexities, the nuances of the clinical situation, stuff that researchers consider noise. Researchers use language that aims at discovering macro truths, broad strokes, and generalizations that apply to large samples of people that might or might not fit the individual case. That group psychotherapy works is one, perhaps the most important generalization driven by research that is important in the socio-political sense of legitimizing our work as group therapists. You can see on the AGPA Practice Resources website a fairly comprehensive and up-to-date listing of research studies that demonstrate the effectiveness of group psychotherapy over a wide array of clinical populations. These studies, often employing sophisticated research methodologies, show that on average, some well-defined group formats affect therapeutic change. Of course, the operative term in that sentence is on average. What the large-scale studies can't tell us is whether any particular patient who is selected for a particular group will show superior response to that treatment, or average response to that treatment, or no change, or even deterioration. Nor will the typical outcome study help us understand what the active ingredients or therapeutic processes are that bring about therapeutic change. Not only do clinician and researcher speak different languages, but they rarely speak with each other. There's little collaboration, little conversation, little communication. Not just in the world of group psychotherapy, but in the larger field of psychotherapy. And to paraphrase from the title of my talk in 2014, the relationship of researcher and clinician is not one of holy matrimony, but much more holy acrimony, mutual contempt and distrust. And the sadness of this state of affairs is that the advancement of the field as a whole is hampered. Ideally and optimally, clinician and researcher should work together to identify what are the particulars in the interior of the group that ultimately contribute to positive outcome. And as I've recently asserted, the study of group process, particularly process variables that are linked to outcome, can serve as a bridge between therapist and researcher, enriching the perspectives of each. While outcome research is clearly crucial in establishing the legitimacy of our work these days, like it or not, process research, the study of those dynamics, conditions, transactions, therapeutic factors that make a real difference, can help researchers think in more clinically sensitive ways and help clinicians embrace scientific values and principles. So, our thesis here in this workshop is that reading group process research literature by therapists, perhaps all of you, has heuristic value in sharpening our conceptualizations and guiding our clinical interventions. And by reading this group process literature, I don't mean learning specific facts or findings. It's not about knowing the difference between an F test and a T test. Well, it isn't. I'm suggesting that our approach to the process research literature as therapists should be of heuristic value, evoking and provoking our ongoing thinking about constructs and their interrelationships. It's not to turn clinicians into researchers. That ain't going to happen. But in enhancing our conceptual tools in understanding the enormous complexity of group life. Take the concept of group cohesion. As you know, it is one of the first group process concepts studied empirically and has led to a very large body of research findings. In fact, it's the most studied group variable there is. This literature on group cohesion prompts us to sharpen our clinical skills in a number of ways. First, the literature shows that there are many ways that cohesion can be thought about, or as researchers like to say, operationally defined. A sense of belonging, a sense of us, a feeling of being part of something larger than self, a feeling of fusion, and so on. Many definitions of cohesion. And while this variety of definitions can be problematic, it also prompts us to think about how we, as therapists, understand the concept. What do we mean when we talk about cohesion or lack of cohesion? Or when we ask, is this group sufficiently cohesive at this moment for the work that needs to be done? But reading the process literature does more than help us appreciate any specific variable. It prompts us to think about the complexity of our work, the interrelations of variables and constructs. While the research literature supports the idea that cohesion is generally a good thing, it also reveals that cohesion doesn't operate as an isolated variable. It interacts with many other variables like time and group development. For example, cohesion may be more crucial in the early formative stage of group than later on. Cohesion affects different participants differentially. For example, cohesion may be more important for those who are anxiously insecure than for those who are avoidant. And the therapeutic effects of cohesion on one participant may depend on whether other members in the group experience the same level of cohesion or not. So cohesion as a variable can be studied not in isolated fashion, but in some complex connection to other process variables. And finally, the research literature also prompts us as clinicians to think about the relationship, as I just said, relationship to cohesion to other important process variables, such as positive bonding, engagement, therapeutic alliance. In general, then, reading the group process literature encourages us to be more conceptually articulate, to sharpen our focus, to increase our capacity to cope with complexity, to contain and hold disparate bits of information, and to think more scientifically about assessing the effects of all of our interventions on the group. And what better way to demonstrate the validity of the assertions and propositions I've just made than to hold a demonstration group right here, led by two clinical scholars. That is, people who have dedicated their lives to integrating research and theory in the service of practice, Sally Barlow and Francis Kaklauskas. And so, without further ado.
We have 6 volunteers to come join the group. Please come on up and join. We'd like as diverse a group as possible.
Treatment now, it's evidence-based practice. Any way you say it, it's irrelevant to my practice, as many clinicians feel. It's practice-based evidence that counts. And he retorts, practice-based evidence? Who cares about your clinical insights? You can't generalize from them. They're completely biased, and it's all fuzzy-headed psychobabble. So that's sort of the level of acrimony that is alive and well between clinicians and researchers these days.
So I'm going to let Francis lead the discussion about how we're going to do this. When we first saw the list, we had about 8 people signed up, so we were very glad to see all of you. But we're tell them what we're going to do and give them a choice, if you would.
I think people will be themselves. I think that works best.
We'll tell them.
Okay. I'll tell you. This is an open session, so we're going to ask people to be themselves. I'm going to give you some guidance on what you could do to introduce yourself in some way. I am concerned about Dan being in the spotlight, his eyes being in the spotlight here.
I'll turn it off. I'm not sure how.
So we're going to lead a group, and Sally and I are going to be probably basing our interventions on a combination of both the process research, what has been shown to be effective, and much of this really comes from clinicians early, say in the 50s, 60s, 70s, when there was clinicians were also researchers or they had conversations. These ideas of structure, cohesion, feedback, interpersonal interactions between group members were really clinical ideas that initially got studied. So in some way, the research really already supports what probably many clinicians in here already do. So we'll have an introduction. We'll lead a group for 90 minutes. We'll ask the audience to hold comments, but to think about questions. What are they curious about? If they have ideas, if they're researchers and have ideas about what we're doing, or ways that what has happened in group reflects upon the research that they know, we really promote people to give comments, questions, and feedback at the end. For the group members, as I said, this is an open session. We're going to ask you to be yourself and ask you to take some risks, but please realize that this is a fairly open container. So we have an audience, and this is also getting recorded. So I deeply appreciate everyone's willingness and strength to come and do this for the service of learning of other people.
And it might help if you want to identify in your heads either a personal or a professional issue you'd like to work on here, and rate it in your head between 0 and 10 on intensity, which is a research project I did about targeting interventions. And if you think about it in that way, it actually helps. And last year, Francis and I had pre-group interviews because our family lives allowed it, but this year it didn't. And that's actually reality. A lot of us don't have time for pre-group interviews, but they're real helpful. The nice thing about all of you is you know what groups are, so you don't have to be inducted into the role of group member.
Well, let's begin. I'm Francis. This is Sally. I guess for introduction, I'd like to know people's names, if there's any identities, pronouns, things they'd like the group to know about them, and a little bit about what they're hoping to get from this experience. And if they wanted to add another piece to this, what do they think the group could potentially do? What could happen in the group that could help them make a little progress on the challenge or dilemma they're bringing in?
Well, I'm Shaquila Mitchell. I go by Q. I'm a research scientist at the Center for Prevention of Youth Behavioral Problems at UA in Tuscaloosa. And what I study, sort of my interest, is therapeutic alliance and bonding, and how, as a group leader with aggressive kids, how can we bond early on, and what are some characteristics that are critical, to establishing a strong relationship with a group of kids who are angry. So,
anything you need from me and Sally?
Whatever you share, I accept. So, I'm a sponge. I love to learn. So. Thank you.
The microphone's getting feedback on the ground.
I think we're getting feedback.
Also, everybody needs to use their mics.
Is there some way to turn them on?
Yours is on.
It's on you, darling. Okay. But it would be nice if we didn't have that sort of ocean sound.
Yeah.
Hey, look, it stopped just because you said that. You're a powerful leader. Yes.
Thank you so much for having the courage to go first.
Thank you.
Is there anything particular you want, or just this more interest in this topic of alignment?
Definitely, yes.
Okay. I'm Mark Azalea. I am a therapist in private practice in Boulder, Colorado, president of the Four Corners Group. I am I don't know. I'm looking to see where this group goes. I'm interested in, I guess, why I came to this was to promote the idea of group therapists adopting research, to try to understand the gulf. So I'm interested to see from the two of you how you make the group research accessible for people and how you make the interventions concrete in a way that might help more group therapists adopt those ideas.
Okay.
We have a couple of professional goals so far.
Yeah.
So I'm Dan Eisenberg. I'm a staff psychologist and the coordinator of the groups program at the Towson University Counseling Center. So that's near Baltimore, Maryland. And I'm a first-year AGPA attendee, and I don't think I know literally anyone at this conference. So it's kind of easy for me to do this because, what's going to happen? Like, it doesn't really matter. So I think sort of personally, professionally, thinking about something that I've been thinking a lot about being sort of a new parent and considering sort of the role I'm in now and what I want to do with my life moving forward, and not really having had a solidified plan. My sort of early career professional pathway has been graduate from graduate school, get a job, see how that job goes. And sort of part of that was becoming groups coordinator, and like, all right, this is pretty good. I like this. This is going well. It's like, all right, so what do I want to do now? Like, is this okay? For how long? So I'm kind of thinking a lot about that recently. And just, coming here was not in service of that, but more so to, learn the strategies to integrate the research. I find myself having a lot less time to read into the literature and try and implement some of those things and sort of just...
Are you seeing Q nod her head?
Yeah, absolutely, yeah. And sort of seeing, like, as we run groups in our center, to see, like, what works and just modifying that on the fly or semester to semester as opposed to, like, what else does the literature say about, like, how maybe to work with this or that? So that would be one of the things that I was hoping to get out of this program today.
So when you got out of graduate school, you thought you'd read the novels you wanted to read and be free to read
no,
more?
I knew I didn't want to read for a couple of years.
Ever again.
And that's, there's still a lack of reading in some of that respect. Yeah. Bits and pieces.
Yeah, it's hard, I think.
Yeah.
Is there anything else you want to know about me?
Not yet.
Okay. Or anyone?
My name is Aaron Porter. I'm from Eugene, Oregon, and I use pronouns. Looks like it's on. Is there a way to turn up the volume on this thing? Thanks for letting me know. Anyone know how to turn the volume up on this? Is that a thing? Or should I just be loud and hold it to my mouth?
Just be loud.
Just be loud?
Yeah.
Just assume this microphone's absorbing my voice.
Just scream. Yeah.
Okay. My name's Aaron. Let's see. Yeah, I use pronouns he, him, and his. Come from Eugene, Oregon. I work in community-based outpatient mental health, working towards my licensure under the Board of Marriage and Family Therapy. I guess professionally, I'm just beginning to work with groups. I did group work when I was a bachelor's degree. Working with adjudicated young men was my start. Love angry young men and underrepresented men of color, men who are survivors of trauma. Love that. And now in community mental health, I want to do groups with underrepresented folks. Oregon's incredibly white. I want to work with youth of color and support group and process group settings. And personally, something I want to learn more about is I notice I have a strong caretaker tendency. There's certain types of discomfort or struggle or attachment injury or hopelessness that plays out with my clients in individual, family, or couple work and in group work that I have a hard time sitting with. I want to caretake sometimes. I want to step in and support. But I also want to respect and send the message that people can handle it. They can do this work. They can heal. And I want to be there helping and facilitating that and to manage my own anxiety when I see a process happening and feeling competent and comfortable to guide that healing process without sort of having to step in as a caretaker. Does that make sense?
Does it make sense to people?
Yeah.
So I'm kind of sitting with that and just want to learn. Yeah, thank you.
So I'm Michelle Collins Greene. I'm a she, a her, and what's the other one? Let's see. I am interested in women's leadership. and some of the things that Sally was talking about earlier. And I like working with angry young women. I am also interested in the interface between research and practice. I'm a full-time clinician, but way back when I did a lot of psychotherapy research and was included in my dissertation.
My name is Jenna Noah, and I am an adjunct faculty member at Naropa. I work a little bit with Francis, and we do a little bit of group work together. So part of my professional interest in being here is connecting a little bit more with you, but also learning about how to be better for the students that I work with at Naropa. I'm also in private practice, and I work with sexuality, with desire, with gender, and presenting on Saturday. Unfortunately, it's during large groups, so I don't know if you guys will be there or not, but perhaps. And last thing I want to say is that I've been coming to AGPA for quite a while, and this is the first time I missed the Institute. So I was excited to be able to step into a group and feel into the experience of that. So thanks.
Thank you all. Is there anything people would like to know more about me? Male pronouns are fine for me. Well, what did people think about? Who did you relate to of what people had said? I saw some heads nods. Can we put that in language at all?
Yeah, I was going to let you know, I'm an angry young man, so maybe you can work with me.
Me too.
We can bond
Work
on
together.
that. Yeah.
You mean it.
What?
You mean it.
I definitely mean it.
But you say it with a smile.
Yeah. Yeah, the anger for me is something that it's a blessing and a curse.
Yeah.
It motivates a lot of work. I kind of have this thing where I have this belief, right, that if no one's going to do it, I'm going to do it.
Yeah.
So a lot of my work comes from a place of fury, right, and vengeance, and recouping something that's been lost. So that's.
Do you know what?
Don't know what. Well, what's coming to mind is association. So when I was conditioned as a child, I never felt comfortable sharing in-process things with my parents. I would always share things that were completed projects. So I was constantly conditioned to present them with excellence over and over and over again. And whenever I'd present anything that was in progress, I would just get ripped apart. My parents would not know how to deal with that.
Wow.
And that's a pattern that I find myself repeating over and over again, where I can look very good on paper and I can accomplish a lot. I come on very strong, very charismatic. But the closer people get to me, the more I end up withdrawing and not sharing those in-progress pieces.
Wow.
So that might be having to do with it.
Okay.
So the anger, it's good. It's I've found a way to channel it into work and be very rewarded by our culture and our society for producing things, right?
Yeah.
But it gets in my way. It gets in my way in personal relationships. It gets in my way in friendships. It gets in my way in connection with myself.
By keeping you withdrawn, or how does it get in your way?
By obscuring my own truth is probably the best way to put it.
I like that phrase a lot, but I'd like to understand it.
Yeah, sure. I can stop with the
I'd
the
like to
poetry.
swipe it and put it in my next book. Obscure.
Yeah.
It's really not.
You can make it a chapter title. Throw my name in there because I need those accolades.
Indeed.
You finished it already. Nice job. Done.
No, what tends to happen is I either don't set boundaries and build a lot of resentment, right, and don't know how to work with the anger and know how to express the anger because I'm afraid of my own anger. So when I feel that things are not okay, I tend to, let them pass in a way. But it's not because I think I can handle it. It's not because I, want to accommodate or caretake that person.
Yeah, I wondered if you two might have an alliance here about this caretaking thing.
Mine comes differently. Maybe yours is the same way. But the reason I end up caretaking is because I'm afraid of expressing anger to the other person.
Yeah.
So that's why, and I end up in situations, romantically, friends-wise, sometimes professionally, where things are not okay. And then I lose my shit.
You lose your shit?
Yeah.
I have a
Like-
suggestion for the group members. As someone talks, you can notice what you think and feel inside yourself and towards them. And maybe when they're done speaking, you could say some of it. So can people agree to that? Maybe? Maybe.
Sounds like group.
What do you think, Dan? Should we see if anyone has anything to say to Mark yet? Or resonates with any of this? Is anger okay in here? Is anger okay for you?
Is it okay for me?
Yeah.
I love anger. When you were talking about working with women with anger, I felt really aligned with you. I felt like I wanted to hang out with you or something. Go yell in a field.
Yeah, I know I want to hang out with you.
Here we are. Yeah, anger's okay with me.
You're nodding your head again
So
at the words.
I like to speak to Mark, but I'd like to put out a disclaimer that I am not a clinical psychologist or really like an expert group therapist or anything.
I barely
but
am either, don't worry
I
about
like to challenge you or see if you would consider to redefine anger and define as fire or passion and things that inspire you.
Can I ask you a question?
Yes.
You're having a feeling of some type.
Yes.
Yeah, what is it?
Because I don't, I guess, agree with the negative connotation about anger. And so you say you like anger and you're able to complete, projects, and it's sort of a motivator to be successful. But would you consider just redefining, anger to something, more positive? Because you've been able to do quite a lot with that, motivation and sort of energy, and create some sort of boundaries around, the fire, the passion to keep you safe, to keep others safe.
Hugh, is
to
this
use
something you
that.
personally understand?
Of course,
Okay.
of course. So,
Would that be helpful if she let you know her story with this?
Yeah, I think I'm more interested in your story than
Right.
trying to renegotiate terms.
right. It sounds
to be
good.
honest,
Sounds
yeah.
good. Well, I feel that there's some sort of similar sort of histories that I have about work or career or relationships that, you are myself, just intense, like to get things done, time specific, take a big task and, sort of break it down. And that can be intimidating or, too much for people, in personal and professional, that may not be on that same sort of thing. But so I've learned to sort of redefine for myself to make others sort of more comfortable with that thing. So I'm not really sure how to define it, but I think it's a motivator, with boundaries. It could be a positive thing if you reflect on, how you can make it more comfortable for yourself and others. Does that make sense?
How are these two doing talking to each other, Dan?
Okay. I think they're. I mean, that's
He'll
not.
have his personal
I
reaction.
wasn't thinking about that, but no,
Okay.
I was like, yeah, okay, but that's my first reaction. But I think, something that kept. And again, I'm not even answering your question, but it's something
don't
that
care.
sort of came up to. We're used to it as
Yeah.
the,
I just want
the
to get all the voices in the
course.
room.
Sort of noticing, like, both of yours experience with anger, and I still, I'm struggling to understand it still, sort of like that personal experience and, what actually you're talking about. You call it, like, a fire and a motivation and stuff, but I don't actually understand what angers you, what that is and what that means about you and why you have to do something with that. So that was the thing that I was actually responding to.
Anything you think about what Hugh said?
More, I was just sort of reflecting on, more personal about your story too, and how it almost felt like you were wanting to, relate more academically in some
Right,
respects,
yeah.
I guess.
I definitely think my personal characteristic, though sort of similar to Mark, is, having...
Look at Mark and tell him.
Mark.
You guys share something?
He's really strong, a little mousy, but definitely feel that, some of his childhood experiences and expectations from parents make you the man you are. And it's not all bad anger, it's actually resulted in sort of a lot of great things on so many levels. So I just think it's great, anger, but so it's more, accepted in society. I'll call it passion. I'll call it grit. I'll call it being a badass, So that's sort of how I like to think about that, term to make it okay.
And this is
being a woman and a black woman, I don't apologize for that.
Well, I'm feeling a little angry right now because...
Really?
Yeah, I
I wonder, we're talking about anger. I wonder if there's angry at us or something, or angry at the situation.
Angry at you.
Should we start with me as the leader before we have the siblings fight?
Yes.
Yes, you would like to
save us from ourselves.
How are people doing over there with this?
Oh, I totally have some feelings about y'all's conversation.
Yeah.
Do you want to express your anger at me first, or is it okay for Aaron?
Cool. Okay. Yeah. I'd love to hear it.
Yeah, I totally can. Like, when I hear you talking about your experience in early conditioning, I think about mine as well, and how having an emotional process was not acceptable. So, and I was also going to say I felt drawn to Q. I was raised by a Korean woman of color, immigrant. So when I see a woman of color, I just immediately feel this pull. She raised me predominantly, but there wasn't a lot of space for emotion. There wasn't a lot of space for process. Also very achievement focused, also very task oriented. So I internalized a sense that like my emotions or my feelings or my process, maybe that's not okay. Maybe I have to hold that back. And then the resentment builds, and then I don't learn how to like communicate where I'm really at sometimes with people because it feels too risky or scary. I might get shut down. So I feel that coming up for me when I hear you, Mark. And also with you, I feel you being an unapologetic woman of color, and I'm like, fuck yeah. Anger is like, because this shit is a lot of reasons. It propels
in some instances.
Right.
How is that to be respected and appreciated?
I just love it. I feel that we're kindred spirits, that I'm going to get his email when it's over.
I saw you this morning in the at-risk youth one. I was like, oh, I should go talk to her, but then we both left. But
nice to meet you.
You too. But I'm sensing this sort of like you trying to tell him something.
That's right.
And like kind of missing each other a little bit. Right. So, but I feel that. And I get the like good intentions that are happening there, but there's a little bit of like a miss there between you two.
Well, I have to apologize now, Mark, because I feel bad. And honestly, my birthright, I'm a firstborn, of a single mom, and she definitely raised me to whatever I like to be, we'll try it. We'll figure it out. So I do not, want to.
Sure, my multicultural triggers are going
I'm
crazy
sorry.
with you
I'm so sorry.
to a white man. No, don't apologize to me.
Well,
just speak your truth, right?
It's just sort of whatever I wanted to be. She instilled in me that I can do that. So,
very
I'm like
important.
a natural nurturer, cheerleader. In my current position, director of McNair Scholars, you're first gen, you're underrepresented. You share your dream, I help you get there. So that's sort of my love language, is who I am, is if you can identify a goal, I can figure out how. And we do that, very collaboratively. So,
would you have some kind of feedback on how I took what you were telling
sure.
me?
I'm any clinics, but sure.
Wait,
I generally have a rule in my groups that people can say their experience,
Yes.
but I'm not into people attacking one another.
Yes.
Should we make that a rule here?
Yeah, I'm not interested in attacking them. I'm interested in just sharing my experience, which is, I feel, when you were telling me those things,
Yeah.
I was feeling small,
Oh, really?
I guess. I was feeling kind of young.
Is that an old feeling, or that you're bringing to the group, or specific to Q, or
Probably a little bit of both, a little bit column A, a little bit column B. And I guess what I was hearing from you, I think your intention was incredible. What I was hearing from you was, it actually felt very invalidating. I felt like it was invalidating my issue by saying, like, hey, this problem that you shared in front of a bunch of people, like, that's not a problem, just think about it in a different way. What I guess would have worked a little bit better, which I'm interested to hear from Dan, what would work a little bit better would be some curiosity around what my experience is like, instead of saying I'm using the wrong word. Because my word of anger might be different than what you mean by anger.
So might be some cultural differences then.
Yeah, totally. There might be some cultural differences, right? And there might be some upbringing differences, or I've read a lot of books on the topic, right? So it would have been very helpful just ask them questions about what it was like instead of telling me to think and feel a different way than how I think and feel, during a lot of my life.
You're letting people know how to get closer to you.
Yes. Yeah. Curiosity helps with that.
How's this going, Michelle?
I don't know. I'm feeling a little left out.
Well, what should we do?
I don't know. To say that I have to have something important to say to deserve to be in it. I was glad to see Q getting more to a feeling level. She did it pretty quick.
Tell her, don't tell me.
Yeah, I was, with the eye contact. So, yeah. I can tell you're a badass.
Thank you.
I
I love compliments, so thank you.
Mark loves curiosity. Q loves compliments. Michelle, what would you love today?
What would I love today?
Yeah.
Oh, boy. To make some connections with people. I always enjoy that in these groups. It's great.
Do you want to do it now?
Well, I hope I did it a little bit already with Q and with Jenna. I knew it was Jenna. I was just afraid I was going to get it wrong.
Can I shake your hand? I'm Aaron.
Hi, Aaron.
Hi. What was your name?
Michelle.
Michelle. Okay.
I know Mark from before. I'm not sure how much we've really connected.
Not so much, but more now.
Yeah. Hi, Dan.
Hi, Michelle.
Sally, how do you think we're doing building cohesion and getting through the formative stage?
I think we're getting there. I just want to make sure everyone can hear, because I see a lot of people leaning forward. Can you all hear?
We can't hear Francis. We can hear you.
Francis, speak up.
Thank you.
Can you hear everybody else?
Just a little bit louder.
Okay, I can do that.
What?
Next.
Can I share something?
Please.
I just noticed it really coming up for me and like a strong emotional reaction. I just realized, Q, I heard you being that like cheerleader that your mom was for you from Mark. And I hear you, Mark, but I just was really touched by you being a cheerleader because I had a, it's like my woman of color mom cheerleader was like my person. So I feel that really, beautiful intention.
Thank you.
I felt it too. I felt a lot of emotion when you were talking about the cheerleader phase, and I was like a little bit envious. I was like, I want you to cheerlead me, Q.
You're the best.
I wanted
my
some attention.
I want to say how sort of I'm impressed with both Q and Aaron. The two of you expressing the emotional element of that. We're talking about your moms and stuff. I was trying to think like what would get me to be feeling like that right now. I'm not sure what it is, so I'm just really impressed that the two of you are like taking those risks with us so far. I thought that was really cool.
What do you care about?
What do I care about?
Yeah, what do you care about? What gets you up in the morning?
My family, I guess.
I didn't hear that.
My family, yeah, and the fact that like I like living, I like life. I mean, I appreciate things, so I just get up and I appreciate the things I do in the day, and I try to take a mindful approach to my life and just living in a way that feels generally connected and things like that. Yeah, and I'm also not. I sort of feel like I have an idea of where you're trying to go to get me to get into some of that stuff, which would be okay. But and I don't mean to sound deflecting. I mean, I don't mind talking about myself more, but I also did want to know more about like the two of y'all's experiences with your mom, because it seems pretty powerful, and if you're willing to share more of that, and how those things, because clearly there's a real connection there, and it just felt like something that I thought would be really cool to hear some more about.
You're a new parent too.
Yeah.
You get some guidance.
Yeah, 6 months right now, so it's hard. It's hard. Being here is really weird too, because I haven't been away from her for more than a day, and so now it's like 4 days that I'm not going to see my daughter. So yeah,
It's a lot.
yeah, it feels weird. So and, like my wife was like, "So you're going to that conference, huh?" So yeah, I'm going to that conference. Yeah, it's going to be weird, but yeah.
And then we have someone who's talking about not having had that experience.
Not having
The cheerleading support.
Yeah.
Oh, and just in that moment,
can
I've
do
had
it.
a lot of cheerleaders, but in that moment, I was like, I want I want a cheerleader like you. I'll call you. Yeah.
Don't whisper. You can't whisper in here.
I'm sorry. You can cheerlead me on the cheerlead me on the dance floor.
Anything more to say to help you stay in with us?
Oh, I would like a cheerleader too. I was just noticing that I feel comfortable with Sally as a cheerleader, and that my mom was actually pretty competitive. So when I did speak up and whatever, it would become a competitive sort of thing.
She competed with you,
Yeah.
against you, in competition or something like that.
Yeah, she had to have the limelight.
That's
And she was very
interesting.
attractive that way, too. So,
As a child, or in different ways, do you think?
she's tried to mellow it out a little more as an adult, and, we've been able to talk about it. But, yeah.
So I think that this is a time-limited group, and we won't always have cues to cheerlead for us. And I don't know if you want to get stuck in that role in this
I
group.
love it. I'm good.
But I wondered if people, what would help people cheerlead for themselves once we end, if anything.
We have to end already?
No, we have
I know,
time.
it's already time.
Termination is coming. First thoughts?
Well, I'm hoping, Mark, I'm curious about your anger.
Is there a question that you could ask me that might give me some direction?
I'm coming out of my own redheaded temper. And I've worked my whole life not to blow up. And for me, it's a burden. And when I was being a professor, it got me into a shitload of trouble. Some of it I deserved, but a lot of it I didn't. And I feel the burden of it, and I feel your burden. I don't know if it is there, but it seems to be something. Maybe that's what you were talking about, Shaquilla, that you were hoping you could see it as passion. But I can feel that it's troubling, and I guess I want to know more about it. And I wish you weren't so troubled.
I think terrified is a better word.
I almost used that, but I was afraid it might be too catastrophic. But I can feel
I
it.
like extremes, yeah.
Yeah.
Yeah, I think terrified is a better word.
Okay, say more.
Or in relationship to the anger. I think that there is a part of me that is very uncontrollable. And there's a part of me that is very cruel and very sadistic. And it comes out a lot in playfulness and mischievousness in my life. But sometimes it comes out very violently. And sometimes it comes out very scarily. And I haven't had a hot anger explosion in 3, 4 years. I've worked a lot around that. But I have a lot of cold anger.
Cold?
Yeah. Or it can be very distant, right? I can shut a lot of doors very fast.
Revenge is a dish best served
cold. Exactly. The hot anger I've learned to work with. The hot anger I've learned to, like I said, use it as fuel for some of these activities and some of these achievements and accomplishments. My cheerleader is more like I think I have this image of like a Visigoth, like barbarian general.
A Visigoth.
Yeah, I'd read a lot of history. Like shirtless, big drum pounding, like we're gonna fucking murder them, like we're gonna fucking take this shit over, right? Like that's my cheerleader. My cheerleader is like it's a war general on like the back of like
No pom
no pom pom.
Made of fire, perhaps.
It's more of a rallying cry. It's a rally,
Aaron's nodding and said you might want to talk with him too.
Yeah, I was enjoying speaking with Sally, but Aaron, definitely. Do you have the same thing? Do you have your own internal Visigoth?
No, not really Visigoth, but just feeling curious and like hearing you. I saw you earlier over there, just sort of sitting, and it made me curious about you, Mark, because I felt like I wanted to know more. So that's why I'm nodding. I'm just sort of with you. Yeah.
Yeah.
Are we talking Titus Andronicus?
Yes.
Yeah. That level, right?
Thank you. I'm so
Okay.
happy that you know about that.
Yeah.
Yeah. That's,
Not all of us do.
Well, tell him.
you can.
No, you do it.
So Titus Andronicus is a general that was leading from the front. And they have statues of him. I think it's the same person. I'm sure we shared. There's statues of him, and every statue that he has, he's holding a shovel. Is this the same person?
I think so.
Yeah. So he's holding a shovel, right? So a lot of these militaristic statues, they have the general, and he's like on a horse, or he's like higher than the people, right? This guy has a shovel, and he has a sword. And his whole deal is every morning he's out there digging trenches first, right? He's out there charging first. He's out there dying with his men first, right? And that was where he was respected, because he was the general that led from the front.
And that's you.
I try to be that. I try to be that. Sometimes I'm very afraid and cowardly, but I try to be something like that. Yeah.
I'm also just curious, and this gets back to my original inquiry, but like, what is it that gets you angry? Like, what gets you fired up so much that you want to do that?
I think social psychology research says the best way to get someone else to talk about themselves is for you to share some of yourself. So maybe you could tell Mark what makes you
Isn't he
angry.
a sneaky guy?
What a pain. I think, injustice. Just when I see it, and just and feeling most often paralyzed to act for justice, feeling just incapable, and either just of status or of position or of ability to do something that feels meaningful and and helpful. So I don't end up. I don't have the same response that you do. I don't blow up or charge in or get real angry and become. I mean, I get angry, but I hold that really inside. But maybe I express it to others through like just my voice. But I don't have the same like charge to act or will to act in that way that I feel like I'm hearing you describe. So maybe. I don't know, maybe on some level I'm looking to better understand that even for myself. Maybe, if there's something that I can take away from your experience and process that would get me to think of how to act in some respects, perhaps. I don't know.
Is that a better way for Dan to go about it with you?
It's a little too quiet for me.
Is that a better way for Dan to go about it with you, Mark?
Yeah, that helps.
Right. Are you two still engaged over there?
I was going to ask you a question, Francis, about anger, because what you were saying made me start
You're
to...
not dropped, Mark. Okay.
Yeah, I got you.
You made me start to think about my relationship to anger, and usually in a group I stay a little bit quiet, and then I get really pissed off. I think that's probably what's happening. But I just wanted to give a voice that my anger is a hot anger. It's like so different than I think the anger that's been described in this room, and it can be really impulsive, and it feels as though it can burn relationship. And so even in process groups at AGPA, I've gotten pretty feisty, and then in the years since just thought about my role in group and wondered, like, what are some other options? Because I think that can be exhaustive, and it doesn't always get me what I want.
Ask Michelle. She's an expert, too.
What do you think on it about female anger?
Well, I was kind of wondering about that when Mark was talking. He seems like, even though his anger is terrifying.
She's trying to look at you, Gemma.
Even though his anger is terrifying to him, he seems like he likes it, or he's, I think the big word we use is egosyntonic or something. Whereas sometimes I do like my anger. And I can be angry. Sometimes I like a good fight. But I don't like it when it happens like what you're saying, because that does feel a little bit out of control when it's just like an explosion, which I do.
Yeah, and I do it more when I'm containing it for too long, I think, or I'm sitting too long with it, and then it doesn't have an outlet.
I don't always realize I'm even containing it until sometimes it comes out.
Oh, yeah. I can sort of feel it when I'm containing it. It feels a little warm, a little tense. It does feel syntonic, though, too. It's interesting, the idea of syntonic versus dystonic anger. There's something kind of pleasurable about it. But there's also something scary about it, more in the aftermath. In the moment, it seems to be pure or something.
Yeah, it's not great when people get angry back.
The repercussions of their actions.
It's not great.
It's not great.
Not great.
No.
When people get angry. Other people? When you?
Yeah, actually in groups it feels worse. A one-on-one, you can kind of feel safer having it out. But to me, in a group, if I say something and I feel like the whole group is having a reaction to me that's angry, I don't like that.
Sort of exponential. Big.
Yeah. And sometimes I don't know what I said that got people angry.
See, that's so strange. The thing I was working with in my institute reminds me of what happened a couple days ago, and it's been coming up in groups a lot. Is that for my system? My mom was hyper abusive. For my system,
Wait, say again.
My mom was very abusive. That's
Of
why
you?
of me. Yes, that's why I'm explaining.
Physically?
Physically and emotionally.
And emotionally?
Yeah.
Fuck.
Yeah. I mean, sucks. I've been in treatment for 10 years around it, so I don't want to get too much into it in this setting. But I'm saying that, I guess I did share it with the group. I'm saying that to say that my system trusts anger. It actually trusts the honest, penetrative force of anger, and it has a very hard time taking in nurturance. A very hard time taking in nurturance. And that's confusing for me. When people say nice things to me, I feel disgusted with them.
Really?
Yeah. Disorganized attachment.
Should we make a rule no self-pathologizing in here?
So maybe I'm saying that to actually practice that and perhaps learn from you of how to take in nurturance and how to take in kind words. That's been more and more of a challenge for me recently. Or perhaps forever, but I'm aware of it more recently.
I'm wondering if that's why we've been in context together, but we haven't really connected. So I'm wondering if that's sort of been an element of that.
You might be too nice.
Yeah, it might be too nice for you.
Yeah.
You too? You joining? I'm not even sure. You know what that means, Aaron? Too nice?
No, I just feel really compassionate towards Marquis sharing a bit of your journey. Kind of makes me feel sort of sad and think about my own challenges and struggles. And there's something that really touches me about men being vulnerable.
Yeah.
So oftentimes I haven't felt permission to honor my truth around my hurt or my sadness. And so when I see other men doing that courageously, we've been talking about that, how it can be hard to feel good, hard to feel connected when you're used to feeling cut off or hurt. It just sort of touches me. Yeah.
Me too.
Thanks.
Yeah. Feel a little safer in myself. Yeah.
How are we feeling? Are we feeling safe? How is the safety in the group?
Great.
Can you say a little more?
I just learned so much, and I have never been in a group setting on this side of things, so it's been very just therapeutic for me, and I feel an awareness of, everyone here, and, I'm really just enjoying it.
Others?
Feels powerful. People are willing to share as we are in the time limited and sort of restricted nature of what we're doing. It makes me want to know more about each person now. I would love to hear more about your story, Aaron, if you're willing to share more. But sort of hearing about your experience, Mark, is pretty pretty horrible from just the words that you said, and you don't have to say more. I get it, yeah, that's why you're angry. Like, that makes a lot of sense. I mean, I'm making a little bit of assumption. I know there's more there than just that.
Totally.
But, like, that alone would, okay, I get it. I feel it.
But you took it in from him. I could see it.
No, I was just playing.
Oh, yeah?
Yeah. It was a little too nice.
You're well learned.
Yeah, well, I mean, just it's not about you personally.
So much for what I saw.
I get that.
But the voice in my head is like, he doesn't know me. Like, what is this? Like, what is this fabrication? Like, it's very hard for me to trust that. And the thing is, my assumption is that you actually do have some level of care, right? But my system is like, no, try again.
Right. And you're constantly like battling that voice and stuff.
Yeah. So I have to do the act and be like, yeah, thank you. Like, thank you. Make eye contact, nod, right? Like, okay, they're doing it. Nobody knows.
I almost saw some like warmth or some like wateriness behind your eyes, Dan. I feel like you're feeling us, and I'm just curious what's stirring in you. Like you're talking about us, but something's stirring.
I mean, I think just it does feel new, this experience too, because I also, like you, I haven't actually been in group therapy before, and it's something I've for the last probably two and a half years, I've thought to myself, how do I start a group therapy with therapists? Like, I don't think it would work. I don't think it would work as a therapist who does group therapy with people who don't do group therapy or aren't therapists. Like, I feel like that would be really challenging. But to be in a group with therapists doing group work,
Only therapists go to group therapy.
Well, maybe that's part of the problem.
It is.
But so that hearing right, I think that's what it is. Like, wow, this is really cool. Like, this is not the abstract idea that I had. Like, this is some respect what that may be like, and it feels really good. So, yeah.
Well, one of my favorite studies about what you're talking about is using the Hill interaction matrix. And they got a lot of, this is a friend of mine, Priscilla Hill, actually, who did a group with clinical students, and they all hit the ground running. Mm-hmm. They all went right into the work quadrant. But then they rotated back through the chit-chat. I mean, I think that's fascinating. Yeah. And the people who weren't clinical psychology graduate students just sort of chit-chatted at the beginning. So they go through all of the 4 stages.
But bounce around.
Yeah. Okay, she just did a teaching moment. I don't know. That's sort of...
You can ask the group what they thought. Jenna, any thoughts on Sally's teaching moment? Seething over there about it?
Seething about it. I think there's something about this group where I feel like there's something in me that's like difficult to land. And it has to do with dual relationships. And I'm just really aware of that and how much containing I'm doing.
You're doing a lot of containing?
Containing. And feeling like if there's like a brigade leader, I'd like to be kind of in the background. And so I felt that maybe there's been a brigade, and I feel a little bit like I want to hide or something, or be in the shadows.
Oh, be in the
shadows?
shadows?
I'm hanging out in the shadows, yeah. Shadows of the brigade.
I think Sally's having
You don't want the limelight, like Michelle's mom?
Sometimes I do, and right now I feel nervous to have that limelight.
Something bad might happen?
Yeah.
Like
I might say the wrong thing, or hurt someone, or hurt myself.
Hurt someone, hurt myself.
Yeah. Yeah, so I feel a lot of tenuousness about taking the limelight. It feels like a delicate place and I feel a little awkward in it.
That's the right
and even
word,
talking
isn't it?
about it.
Delicate.
Yeah.
I'm feeling a pull to be provocative about something.
Oh, yeah?
But it's going to be a little challenging, Jenna, maybe, I think.
You're feeling the pull to be provocative?
Yeah, saying something to you. Is it okay?
What's the hope? What's the hope?
I want to bring Jenna in more in what I'm going to ask her. So I'm hoping this brings you in, but I recognize it might make you feel even more uncomfortable.
I'm into provocateurs. So let's find out.
But behind the question, there's probably some kind of statement about you. Maybe you could just say it as a statement, and Jen can respond or not.
Okay. It might be that there's a part of me that doesn't really believe what you just said.
Oh.
Because I saw you volunteer with Francis, right, like at the very beginning of the session, before even like he was coming around. You were like, I want to do this. And so it's like, you do? Well, okay, let's do it. What's like? There's something I feel like. Okay, so what? Like you're not sure though. You're putting your foot in the water.
So you're noticing something about me, like my willingness to be in the circle, but then also so they're not buying something about my tenuousness.
Yeah, like no, wait, you really wanted this. You want to be here. So like,
I know.
Let's like,
I know.
why can't we have you here? Like,
That's a great question. Just playing hard to get. There's totally a desire to be here. When Francis asked the question, like, what about your own inner cheerleader? I was like, oh, my inner cheerleader is going to be like, yeah, I sat in that group. And that's just my truth. Like, just being here is actually enough to give me a lot of satisfaction. And so kind of risk assessing how to show up or what to say is also really present for me. So there's some filtering.
Yeah, you're feeling like the need to monitor a lot.
Yeah. Yeah, I feel that really strongly.
Which also has to be weird. I mean, you know Francis, like you said, you work together. Like,
we co-teach together.
Yeah, like
that. Group.
That's got that's got to be difficult.
I'm not monitoring on behalf of Francis. I think I'm monitoring on behalf of myself a little bit, and maybe even what feelings I want to have or feel. So there's a lot of containing, and I really appreciate you bringing me in and noticing that part of me. Because I do want to be here. I'm very aware that I want to be in this group, and I'm really excited about being in it. It's very provocative, and it's also challenging for me.
I get a little bit uncomfortable just imagining what it'd be like to be in like a dual roles relationship in this group, you know? As you say that, I'm like, oh, like I would feel, depending on my relationship with that person, if there's any power, differential between us, I'd be like, whoa, how much can I share here?
What's your name?
Aaron.
I think that's very accurate. In my experience.
How's it feel that Aaron sees you in your situation?
I feel softened by it, and I feel really, really seen, and really understood. I think what you're saying is very true for me, and it's nuanced, and I appreciate nuance. I just think it speaks to your awareness, and I really am appreciating my little mini limelight with you in this moment.
How is it to be between them, Michelle?
Oh, I'm just trying to let it happen. I'm appreciating the connection. Fine.
Any thought about joining in it?
No. They're doing fine. I'm okay with it.
Okay with it.
That was provocative.
Just made me curious, I guess.
Yeah, I guess I'm okay with not stepping into the limelight. Okay, so doing your thing. So I like that.
But you also wanted to be connected some today.
Yeah.
I think you're speaking to the dilemma of every group member. When to take the limelight, how much limelight to take, what might happen if I take the limelight and be who I am.
Yeah, I guess what I went through with my mother, I don't want to do that to other people either. Or to myself, but to other people.
Had a big impact.
Yeah.
I want you to take the limelight.
How come?
Because I want to be her cheerleader a little bit.
You want to what?
I want to be her cheerleader a little bit. But
Cheerleader.
Also, cheerleader for you, but I also want to get to know you a little bit more. So I think if you did that, it would allow me to know you a little bit more.
Okay, I'm getting a little stage fright right now, though.
Well, you know, that stage fright thing, I've seen 2 spotlights shown on the stage. So it doesn't have to just be one spotlight. I've always wanted to get to know you more, too. And if I had to pick one word to describe you, it would be shy. And I'm just sure that you're not really shy. You're really in there and you're alive. But I'll tell you, that comment about your mother just like would ka-ching. That's it. Wow.
Yeah. Well, I do kind of have a shy gene, so you put that together with a mother like that. It's kind of. But I also have another side to me that likes to be a leader and likes to make things happen and likes to have something to say and be in the limelight sometimes.
I want to get to know that person.
Like being in charge of the women's SIG.
Yeah.
I did not know that about you, Michelle. Yeah, I saw a lot of those. Yeah, I was like, so that means something. There they are. Okay.
I feel a little bit sad because I feel like the sense that you probably hold a lot of space for other people, but yeah, it's hard to take it sometimes.
You know anything about that, Aaron, too?
Yeah. I feel like I have that's like part of my therapist baggage. Makes me think about my own therapist baggage, how I give a lot of permission, and it's hard for me to take that same care for myself.
You're nodding your head.
I agree. That was me. 8 years ago, though, at work, if you want it done, Q can do it. She's your go-to, sort of thing. And I took pride in that. So,
You have to what?
the worker bee, or if you want a certain thing done in an impossible type timeline, she can do it. And that'll be me. So.
Looks like you're going to cry a little.
Yeah,
I have.
Say more.
I can't.
You can.
Can I just say the reaction I'm having to you right now? It's like that. Obviously, that's been such a burden for you. That's something you struggled a lot with. And there's a part of that where I feel like, no one asked me to do stuff. I feel like I do stuff, but I don't have people at work or a lot of other people saying hey, you could be really helpful right now, or I could really use you for X, Y, and Z. And sometimes it feels like, well, I guess I'll just go and do what I do, but it doesn't really matter that much. I'm not needed that much, and that sometimes feels empty and just sort of makes me float a little, where I don't charge in, maybe like you do. About
Yeah, that's why you need the general.
That's perhaps.
No, really, because those people don't owe you anything.
No, of course not.
Yeah.
But Q does something with others, or had certainly those 8 years ago, where people like you're the one. People know that they can go to you. There's a part of that I think I would like also. Maybe not as much as you had to deal with, but
it comes at a price,
Which is?
Family. You compromise. Where is the Kleenex? Question. Sorry.
That was
But
my
definitely-
responsibility.
Use my jacket.
I don't want to.
Last day, I'm presenting an
Seriously,
award
it
again.
comes at, it comes at a price for sure.
can I say I feel a lot of compassion for you right now. In part, I think that comes out of privilege because as I think about it, I think I'm making some assumptions, but assume it would have been much harder for you as an African American woman to say no and what that might mean and how you're perceived. I also, thinking about it, I might project that I'm not going to sacrifice family. I'm not going to stay late. I'm going to go home, because I can go home, and that's what I feel like I should do, and maybe I have the privilege to do, and haven't really had to worry that, I'm going to be looked at in a certain way because of that.
See that daughter of yours?
Yeah.
Be with her.
Yeah.
My favorite part.
Even before that, but yeah.
Yeah.
But I think there's a lot that I get by not doing anything that you haven't had the same privilege of.
Right. I totally agree with what you just said. I definitely did more and accepted more tasks to be seen, to be valued, to have a seat at the table. So That is so true. So
Spot on.
that's right.
I'm just also aware that you both are sacrificing family, like in different ways. With a really young baby, I imagine that's like really intense.
It's nice. It's good.
Or is it self-care coming?
And the cost is real.
Yeah.
Caretaker.
Well, I'm just thinking of what it was like to have my mom working 15 hours a week. You know, that cost is real. Like, I really felt that.
Yeah.
It was really hard, and I know she did everything for me, to protect me and keep a roof over our heads, but it's like, it is a cost.
Yeah.
Yeah.
What did it cost you?
She was depressed, unavailable. Because she had to be. She didn't know anything else. Yeah. I'm so thankful now we can talk about it. But for a long time, it was like there's just this wall. Totally cut off, totally overwhelmed. That's what I feel come up as I hear how hard you work. I respect that.
I cannot take this group. Do you all prescribe medication? Oh my goodness.
What feelings do other people have? I'm going to give you a little break.
Isn't he the best?
I love you in a professional way.
Are you open to receptivity?
What does that mean?
Some people in here haven't been open to compliments. I love spending this time with you also.
Okay, sure. Thank you. Love you.
I've heard this phrase over and over this week, not enough love for even one child.
What in the group's reminding you of that?
I'm hearing about parents who've had to make sacrifices, parents who were away, parents who were burdened, people feeling seen, validated, attuned to in here. That's my defensive reaction. I don't know why the hell I said. Anybody know why the hell I said that? Some projective identification process. I'm start speaking for someone else.
Did you say that's a defensive reaction?
I'm playing.
Maybe.
Are you?
That's what came to my mind. I'm modeling being associative as a group leader, and I welcome that from the members.
But I'm definitely feeling it, feeling the connectivity of the group, and feeling like why isn't there more of this? Why can't more of this exist? Because it does feel really meaningful.
Except I'm seeing the look on your face, Mark. I don't know where you're at with all this lovey-dovey stuff.
Where are you at with all this lovey-dovey stuff, Michelle?
He's got a shovel and a sword.
Well, I like it. I'm pretty comfortable with it. But I guess when I see somebody distressed about it, I want to bring them into
my multicultural flag
if
is
it's possible,
going
Mark has said
berserk
it's
with
not
a woman trying to make sure she makes room for a man and a man's feelings.
Oh, don't make me sick.
All right. All right. You can hit me with a shovel. But people want to get to know you more also.
Okay.
Yeah, I mean, this is like, whatever, it's like the 10 on your scale, right? There's a sub-narrative going on in this group where I have a dual relationship with Jenna, so I'm feeling very upset at you, Francis.
Okay.
I'm very set up and betrayed
Okay.
for telling me to be in this group and missing my other session to do this. So that's why it's not about the lovey-dovey. That's like really great, and it's good that you guys are getting a lot
It's
out of
about
that.
what we're talking about, the complexity of relationships. That we also have a relationship. We're part of the Colorado Four Corners group and colleagues.
Yeah, I mean, there's more there, but it's fine. I mean, I guess when I was thinking not enough love for one child, it seems like I don't feel seen by you.
What would you like me to see now?
Well, I would like you to see my history with Jenna before bringing me into this group and having me miss my other session, in order to like. I mean, I was doing this to support you and
I
your
appreciate it.
growth and your thing, your presentation.
I appreciate it, and it's an interest we both share. I appreciate you giving me support. I'd like to give you support now. Is there anything I could do or say at this point?
I think just saying that like you understand, and then continuing, the group, because I don't think it's appropriate for this setting.
Okay.
But I didn't want to name it because I don't want to sit here and I don't want my anger to be taken as like some kind of judgment on what else is going on. I'd rather name the sub-narrative.
So
There's some tension.
educate me. How do you know Jenna?
We used to date.
Oh.
Yeah. Right? So I want to make sure that things are, taken with that, I guess.
That would be hard on me.
Sure is.
Very impossible almost.
Almost.
So then why did you put me in the group? Why did you put both of us in the group?
I've invited people who wanted to join the group.
I volunteered. I'll just speak for myself. I don't feel like I was forced to be here in any way. I chose to be in this room and into this group, knowing that you were in it.
People are leaning in. They can't quite hear
I
me.
chose to be in this room and in this group, knowing that you were in it. And I assume just because you saw me in the room and saw me enter the group that you also made that choice of your own accord. But maybe it was Francis's fault.
It's both. Yeah.
Mark, can I ask what prompted you to bring up these feelings? I wasn't aware that this was something bubbling under the surface for you. I didn't know that the sub-narrative was present. I'm not sure what happened that it came up for you.
I guess I'm a good actor. No, what brought me was that Michelle was commenting on my feeling like I wasn't buying what was going on in the room.
Yep.
So I want to be clear about what was going on for me instead of it being misinformation and misunderstood by the people who seem to be having a very real experience in here.
Yeah.
And I don't want that to be taken away from.
Yeah, and also, I guess for me, it also fit the narrative you've presented that, that's almost like a default then for you, though.
What is it?
Is it not? The presentation, like the hard presentation, the hard default sort of state.
It's not even almost. It is.
It is, right, yeah,
It
okay.
is.
And so that was, I guess it was surprising for me to hear that was also there, as opposed to just like, it doesn't, like that lovey-dovey whatever doesn't hit you in the same way maybe that it was hitting the rest of us in some manner.
That might be true, but my mind was preoccupied.
Yeah, okay.
But Francis shouldn't have asked you to be in it because you can't say no to him.
Yeah, there's a power dynamic happening there. Yeah.
And if you had it to do over again, would you say no?
Totally. Well, I don't know. I mean, we'll see what happens out here. I do like stimulation and intensity, right? So, like,
Truth comes out.
Yeah, I mean, we'll see what happens, right? So I don't know if I can answer that quite
Okay.
yet. I'm not like injured.
No, I don't.
I'm
I
just.
don't think so.
Mad? You're mad at me?
I'm mad at you.
Yeah.
I'm mad at you.
Really mad at me.
Yeah. Yeah.
I can understand that now. I overlooked something, I think.
Yeah. And then when you're saying about not enough love to go around and not being seen, that's what triggered those feelings and anger.
I know you, and I thought you'd be a wonderful group member with a lot of vulnerability and honesty and depth. And I didn't consider all the possible variations weren't on my mind.
Yeah.
Do you believe that?
I do believe that.
Right.
So I'm here.
Okay. Can I apologize? Is that okay? I'm sorry.
It's totally okay.
And I hope we can continue forward and talk more about it and continue to have a good relationship.
Yeah, totally. I'm not, I'm not that mad.
Well,
I just
gentlemen,
want to cheer for that pure moment. That was awesome. I can't help it.
You're such a good cheerleader.
It was awesome. It's who I am. So.
Yes?
I was just thinking, like, that was uncomfortable. Yeah, I could just feel the tension. It just got really real. And it's also really real. It felt really genuine. I also kind of felt touched by that like receptivity, like you all engaging with each other and being present with each other and like being restorative and apologetic. Yeah.
It's nice, huh?
Yeah.
I love that about Francis.
Yeah. I'd heard about you. Yeah. And I looked you up, saw you in an email. I just was drawn to you. Like, clicked on your website. I was like, cool website. But yeah.
That's his thing.
But I also was just like feeling into like what you said earlier around like having a hard time setting a boundary and then getting upset about it when that boundary isn't there.
Exactly. That's what happened.
That's what I was feeling from you.
Yes.
Yeah.
Yes.
Yeah.
I feel seen by that.
Okay. Yeah, makes me think of my own struggles at times to know where to draw my line. Yeah.
Want to say a little more?
Say a little more for me?
Yeah, because when we first started, you said, I'm kind of a natural caretaker.
Mm-hmm. Mm-hmm.
And I don't always want to do that. I know I should be able to, I should allow people to do some of their own work. At least I'm paraphrasing.
Mm-hmm. Yeah, that's right.
I write it down. I'm getting old, and so I have to write things down.
Oh, yeah. Gotcha. I think my growth area has at times been like owning my truth. You know, not just doing what is expected of me or what I think I need to do to be good enough, to feel good enough and battle my own unworthiness. Like I spend a lot of time.
That's just beautiful. It's obscuring my truth. So keep talking. May I touch you in support?
Yeah, totally.
Oh, I
We
mean,
can write some poetry
owning
here.
your own truth. Wow.
Mm-hmm. It's hard. Feels really good though. Yeah.
But it's a little bit like Melanie Klein's depressive position. Your mother paid a price, and you feel bad about that.
Mm-hmm. Definitely. Yeah, I took that in a lot of ways. Yeah.
Want to shed that?
Definitely. Yeah, definitely ready to let that burden go. Been working on it for a while, like Mark said. Been some years in therapy shedding that burden. But it's like a daily process sometimes.
It is.
Yeah.
I hope it's okay if I say that I have a son who's probably your age, and I was a single mom, and it was costly. But I don't want him to feel the burden of that. I want him to feel free. And I would want that for you, too.
Thank you.
I bet your mom, you said that your mom says that. Like, you talk now, right?
Yeah.
Yeah.
Yeah, I know now that she wants that from me, too.
Yeah. So it just is what it is. It just matters so much that we pay attention to our children. And, with this whole conversation, when you were talking about your mother, I had this constant memory of the one time I lost my temper with my son. Oh my God. If only I could take that back. If only. But it is what it is, and I'd like to pretend it never happened. But at least we're talking about it. Like, he came for Christmas and he said, with his girlfriend who I adore, and thank God for that, he's finally found a partner. And we were talking about my ex-husband and what a mean guy he could be. And Jack, my son, said, well, Mom, you've got quite a temper. Oh. And I said, yes, I do. It's so hard to own all of it. And I wish... Has your mother ever apologized?
No.
No?
No. Yeah, I'm having a confusing experience because that's a lot of disclosure from a leader, typically.
Oh.
So I'm not sure how I should respond to that.
Too much?
How about authentically? Right?
Yeah.
Being true to yourself.
Yeah, it's just more than what I'm used to. But, no, my mom doesn't. She says I'm a liar.
Oh, my.
Other reactions besides having Sally do all the work?
I'm just going to say that I'm really aware of like visible and invisible identities, and it's so uncomfortable to kind of have that little piece outed for me personally. And I was reflecting on why, And because of the nature of this dynamic, it was so professional and so personal and so public. And I'm holding some resentment and related to that, both from being like publicly removed from the board of directors that I was on with Mark. But in this moment,
Are
it
you
doesn't.
feeling something towards me?
I'm
that
feeling
I
a lot
said you
towards
to-
Mark. Actually, I'd love to make it about you, but I can't. I'm feeling a lot of anger, and it's just like where the private isn't private, and then
Is it hard to make eye contact?
with anyone. Yeah,
Yeah.
it is.
We're here, darling. We're here.
Thanks. Yeah. So yeah, there's something I think kind of loaded, and I'm a little
Angry. You're
I'm
angry. People are angry. People came
Yeah,
in
I'm
here
angry.
wanting to learn more about anger.
Here we are. I'm really angry.
What would be typical? What's a typical thing that may
To-
happen for people? Yeah.
For me, if
Yeah.
I'm angry.
I'm loving this. Explosions, revenge served cold. So many wonderful options, huh?
Yeah, mine's not cold. It's just really hot, and I feel
Hot.
really frustrated
Burns
and really
people.
contained. Yeah, it burns people.
Dragon.
I don't want to burn anybody.
You mean like Mark?
Yeah, I don't want to burn Mark.
Yeah, I'm
And
not
I do.
into public burnings.
I feel a little bit burnt right now, and I kind of want to burn back, but I'm doing my best.
How do you
burnt?
feel burnt?
I feel like addressing that our relationship was public wasn't talked about beforehand, so it was an agreement that wasn't an agreement, but I feel like it's a repetition of what I felt in the breakup, which was a lot of public awareness about something that was personal to me.
I have no objection to you dating Mark. I like Mark. And I like
I
you.
used to like him too.
Oh, and I
Michelle,
was,
you have any? Go ahead.
I was the one who didn't know what was going on. And maybe
Yeah.
I should have just kept my mouth
No,
shut.
I mean I think it's it just didn't get negotiated, and so I was like, oh.
You're right. It was not negotiated.
And I was containing a lot anyway. It felt a lot of relief actually having it named. I could just name that for me. I was like, oh, okay, that's not just only being contained, but then it brought up memories and a lot of
Memories.
frustration.
And
Yeah,
frustration.
memories.
Such a wonderful topic for an AGPA group. Dual relationships, history. How do we manage them? What do we name? What don't we name? You have any thoughts on this? I think you have a relationship. Two longtime AGPA members have relationships. Any?
Yeah. Well, he's kind of looming back there.
I guess people don't know. Michelle's husband is one of the presenters, Wes. So you've had to deal with multiple complex relationships here, I'm imagining.
Yes.
Both of you being leaders. And
So
And you've done your ABAP, and he hasn't.
I haven't done the whole thing yet.
We haven't. I guess that shaming isn't going to get him to do it.
you must have learned that from someone.
Yeah, well, you bet.
It's my next project. But yeah, in a way, I feel like you're handling this really well. In another way, I feel a little panicked for you.
Sort of vibrations coming from her.
I don't know if they're coming from her or from myself.
Okay.
Just being aware of the situation and that this isn't confidential and it's on tape now and
Right.
so and that's the whole issue for you. I think it's unfortunate that that you're stuck in the bind of having to contain it and yet make it clear.
Yeah, containment comes at such a price, I think.
I think lack of boundaries can come at a worse price.
Say again.
I think lack of boundaries and not containment can come at worse of a price.
Okay. So
That's been my experience.
Yeah, so you'd like a new experience.
Yeah.
Where you could be who you are, not obscure yourself, what was your phrase? It was great. True to myself.
And choose what to
that's
contain.
hard
And not
work.
have choice. Living is hard work, Barbara. Did you hear Sally? Sorry. Living is hard work. I guess we just choose the things we're working on, but I guess maybe there's ways, and maybe you know more because you have a long-term relationship in this group, or maybe just with histories of AGPA, like.
But I think a breakup is harder. I mean, we're not broken up yet.
He smiled. It took him a second, but he smiled. Can I comment on, I think, the process of how it feels? I kind of feel like things are different now. Like they felt, maybe that's obvious, but like it certainly felt differently when we were all, in my mind, like working together as sort of relatively new with each other. Because I'm new with everyone here, and I wasn't aware of the subgroup that like was present, and now like. It's moved away, I think, from us talking about ourselves and each other in the space to, like, some of the history and some of the dynamics and the power, and that at least has felt it's felt a little separating, a little isolating. I feel like I don't know if Aaron or Q was feeling some of that. Michelle, you're in there a little bit, but I was feeling some of that as in these last few minutes we were processing.
Wonderful comment.
Touche.
But something that happens in groups, people get close and then people have a rupture. They can repair or not repair, or someone flights from group. Sometimes if two members are having a hard time, other members won't do the work or caretake, or I'll take the spotlight. I wonder what's going on for the other people in here. What message do you hear from having this eruption, so to speak? What are you supposed to do when this happens?
What am I supposed to do, or what do I want to do?
I'd love to hear both.
Yeah.
I'm not sure what's supposed to do. So I guess in my group, we would, group of middle school age aggressive kids, we would reestablish group norms, go back to the identity of us, right, our co-empowered group. And we will make everyone feel safe, feel valued. We pause on the content of today's session, and we really reestablish unity. Right.
Everyone has something in common and differences who are sitting up here.
Another option that I wasn't sure if you were going to choose or not would be to ask if either one of them felt so uncomfortable they wanted to leave the group. I think there's all sorts of consequences for that, but I don't know.
I thought of that.
Yeah. I think, I don't know, they should speak to it, but my point of view is they're both pretty, what's the word for it? They're both pretty persevering and probably would choose not to leave.
And what do you think about that?
That's probably what I would do in the situation.
You'd persevere and stay?
Yeah.
I can't tell whether that's something you admire or something you think isn't healthy.
I guess that's a questionable thing. Yeah. It's a boundary thing, too. When to protect yourself and when to stick it out.
Get in the spotlight.
Yeah.
Yeah, I agree with what Dan said. There's a huge shift in the energy here, but is also really real and makes me think about like I know my therapist is here, and like I know that there's just like multiple roles happening. I know I've like pushed into an edge when I was in my process group and like shared some feelings of feeling attracted to someone in my group. Never done that before, like in a setting like this. It's always been really scary for me. So, like, have this weird mixture of like, ooh, this is intense and really real, and like also feel like, I don't know, it's kind of refreshing that you all are naming it, but also I totally get that naming it could be like a violation in like some other boundaries because like that's a thing. But makes me think about what this journey will be like as a professional and this building this rich community and relationships that will come. Because I'm definitely building relationships, some more intimate than others. It's my first year, and I'm loving it. So,
Can you tell me more about how you feel?
Part of me wants to caretake for you two. Like, I want you two to be okay. I noticed that for me. Like, it's a little bit uncomfortable. But also, I guess, kind of refreshed at the realness, but kind of sad. Like, watching y'all's pain makes me just feel kind of sad. But I can accept that.
How would you caretake me?
I don't know. I think about like, as a couples therapist, I do like want there to be repair sometimes, even if like that's not my thing to take on. Like I want for some reason you two to like have some way of like creating some kind of repair. And I think that's really much my own thing sometimes. Like as a kid, split up parents early on, I stepped in and tried to like make things okay. So maybe that's what's coming up for me. I like really get excited when people can come together and repair. But you know what? That shit's not always possible. That's out of my control. Answer your question.
Yeah, that was helpful.
Yeah.
You don't want to put your agenda on them, your old agenda. I think this is a wonderful question, and I'll just share the way I navigate this. I feel at AGPA sometimes I'm in the role of student. I try to be the best student or group member. Sometimes I'm in the role of teacher. I do that, and when I come here and walk through the halls, this is my 20th year, I just assume a third of people like me, a third of people probably dislike me, and a third of people are way too self-absorbed to notice. And I try to give my attention to the third of people who like me. So I don't know if that's good advice for newbies. What do you do?
I'm a newbie and I love you. So. Oh my gosh. Sway, so intense, so intense.
How much time do we have left?
Hopefully none. Hopefully. I don't know.
It's 11:45, right?
Whoa.
What do you mean, Q? There's a lot to do. What are you talking about? I think my reaction that I think I was feeling aligned with you, Jenna. I think I felt like maybe a little angry towards you, Mark. It felt like a violation to out the previous relationship that you had. And I almost saw that as you were angry towards Frances more than Jenna, and
Yes.
pulled her in a way that she didn't consent to, and almost as a way to, like, I don't know, it felt like there was something that you needed to do in order, like, to out her in that respect. I felt like that was a little disrespectful.
Are you a little angry at me too? I think this was my mess.
I don't know.
That I didn't realize that there was a history at the moment, thinking of two people who I like, who are smart, who are great group members, and didn't think of the history, and I...
Getting that wet.
Yes.
I think
And what could happen, or didn't set up the container at the beginning.
It might be a good thing, though. I mean, maybe they're going to be able to sit in the room together after this and have some sort of way to communicate with each other post-relationship in the public arena.
I mean, I really appreciated the rupture repair that the two of you did. I really liked the model of that. That was really nice. I did feel like it would have been helpful for Frances to know a little bit more about the dual relationships that were present in the group before we got started. So, all right, I guess I can be a little angry with you. it's not going to do much. I'm not going to carry it for very long.
Well, why do you get angry at me then?
Oh, I'm a little angry.
Yeah. Can you tell me about it?
Well, I felt like it was disrespectful what you did to Jenna, to sort of out that you two were in a relationship, and honestly, it felt a little attention-seeking to do that.
Yeah, I might
It felt a little self-serving.
I might need that mirror. So can you keep talking?
You were angry at Francis. What I observed is that you were angry at Francis, and that what Michelle had said sort of brought that up, reflecting on how the group was processing, and it felt like you wanted to express that anger, and you sort of were out there on the front lines maybe, and you were vague about it initially, and then I think you, Sally. So I think you.
I'm the one who said, "Well, what is it?"
Yeah. I think you brought a question mark more about that, and then you said, "Well, because of the relationship that you have with Jenna," and that felt like a real shift. Like all of a sudden, something else very big is present in the room, and that felt kind of unnecessary. It felt like, well, that clearly changes things, and maybe informed a little bit for you, Jenna. At least for me, what was keeping you maybe from engaging further earlier in some respect. It's like, oh, that kind of explains a lot then, doesn't it? But I also don't, it felt like it didn't do anything of value to the process of our group. I mean, maybe it did, maybe because we're talking about it, but it sort of shined the light.
You're angry at me because I wasted your time.
I don't feel like it was a waste of my time. I feel like it was a little selfish.
Yeah, so I'm interested in that.
Okay.
Yeah, I'm interested in. This could be splitting hairs. I'm interested in what's really making you angry, because I hear that you're judging me, which is great, which is fine, right?
Okay.
Like, I'm not using that as like a pejorative thing. Like, I judge people fucking every day of my life, right?
Well, I don't mean to judge you. I mean to judge that behavior. I felt like that behavior was selfish.
Is this happening again, a fight between two members that Sally and I are in charge?
Well, I'm not trying to fight him. I'm actually trying to say, like, I'm not, like, I get.
Well, you said this is what you do, right? This is, you're looking for criticism.
Yeah.
Someone in here might think what you did was courageous, naming a dual relationship. You held it with some containment. Right. But I just wondered if you're more interested in having some repetition of what's wrong with you. That sounds very old, or potentially, I hate to make this big interpretation, maybe getting abused a little bit in here.
I can hold that hypothesis. Yeah, I can hold that hypothesis. I was interested in learning more about Dan, about why he is angry, but I could see that could be an unconscious thing. Yeah.
I don't know why. I keep wanting to see a softer side to you, because you initially presented as like this angry guy, and it was kind of pushing people away. I'm not going to accept your soft advances towards me, but I misperceived you once already. My perception is that since you did open up about that you are actually wanting more people to come towards you more in a nice way. Not just, maybe that's the only way you know, is to get beat up. And maybe, I don't know what goes on in your head about that, but I feel like you would like some more warmth from people in the group. And
You'd have more warmth for him.
I am.
Me too.
Yeah. Yeah.
How's that side of things? A couple women here were feeling warm towards you.
Yeah, I'd like to experiment with that. Because I mean, you're right. I mean, there's a very pushed down part of me that desperately needs that type of loving connection, and is very confused about how to get it. That is 100% true. And I'm more interested in working in the present moment and maybe trying to take some of that in. That might be more helpful than talking about theories.
Mm-hmm.
I know that was a very combative way of saying that, but
I got it.
Yeah.
Not that combative. I don't think you're as combative as you think, Titus. I have the struggle I'm having is, which is really human. I think we all have it. Is I just want to beat your mother up, but of course that just doesn't work. I wish she knew her impact on you. That's just devastating. And we know what the research says about kids who are hit.
We hit back?
Hmm?
We hit back? We hit our kids?
They really struggle with self-esteem.
Yeah.
It's so fundamental. I mean, that's why Sweden has a law against parents hitting their kids. It's so awful.
We also know research on resiliency and the effectiveness of treatment.
You seem real resilient to me.
I can take that in. Thanks. Yeah. Take that in.
So we're running out of time.
But Jenna might need some attention.
I started thinking that too.
I'm just really getting excited about hanging out in the shadows.
And I was thinking Jenna might need some attention.
Oh. I don't know what that was.
Okay.
What gave you that idea?
Do you know what type of attention? You have a guess or a hint?
I don't know, just some acknowledgement for your presence here and what you work through in the group.
Thank you. Appreciate it.
I appreciate you showing up and even naming that, like, the hurt, in this whole what's going on. I appreciate that you showed up in that way. It sounds like that was risky. It was, like, nice to see a little bit of you.
Yeah. Yeah. Thanks.
Anything you want from Sally or myself?
I want like a little bit of like maybe like a half teaspoon of validation.
A what?
Half teaspoon of validation.
Half teaspoon?
Yeah.
Okay, I got one. So you're elegant and serene. That's the presentation you have. But when I was coming around the corner to enter the group, I saw your terrific boots, which are sort of kick shit. Like they've been through it. And I just thought, wow, that's a great package.
Thank you.
I mean, I would just hope that I can say this is a 68-year-old. I would hope that you find a way to say what you're thinking, because it's got to be important, and not over-contain. So that the boots get a little bit more speaking time.
Instead of kicking time.
I would hope.
Thanks.
Yeah.
I appreciate your willingness here to be with me, and there's many people in Boulder who do group psychotherapy, and I felt happy that you were willing to work with me and do that together with me in Boulder, and work with me here. And I would apologize to you too for the difficult time you have, and deeply hope we can continue forward. And I hope that you had felt my respect for you before, and can feel a quarter teaspoon of it now or something.
I feel more than a quarter teaspoon of it. And I just want to restate that I don't feel like in any way that you violated my consent. I feel as though I chose to be in this group. And I'm grateful that I did. I'm really glad I was here. And I think that you're both very skilled facilitators. So thank you.
Thank you.
I think there's some learning that happened here today. I think we're running close to time. What are people walking away with?
I'm happy that Q started all this. You did. You were the initiator.
Unleash the storm, or what happened?
Let the love in. This is something we're working
You're
on
just
as
real.
a group.
You're just real. Really nice. Thank you.
You walking away with anything, Aaron?
The first thing that comes to mind was like, so that's why you do interviews beforehand.
That's good learning.
That's not that there's anything wrong with what happens. Yeah.
On the nose.
Yeah. And just like the inevitability that this is going to happen.
Yeah.
And like I don't know, I'm building this trust that like people are going to be okay. Like y'all are going to be okay. You're skilled people. So that's good for me.
thinking about I hear some of your own bias about caretaking, making things better. Yeah, everything's gonna be okay. I didn't necessarily feel the same way. But I also feel a little. I don't know what the right word is, but there's a part of me that feels well, this is something that's happening. I'm not going to be able to do anything about it. I'm not really a part of it. So I was a part of this, but I'm going to leave here, and that's going to still continue, and there's not much to do, and I feel a little...
helpless?
A little helpless, yes.
I'm interested about you, Dan. What do you... You came in here to learn something. Okay.
I'll get there. So in continuing along that, I want you to know that I don't see you as the villain of the group or anything. I don't
think that. Yeah.
Okay, I'm just making sure.
Yeah.
And I feel even though sort of we went to a place that was atypical and certainly not what I expected, I think there's value in that. And I think we did a pretty good job of managing that and talking about it. And I think, God, I wish we could come back and do this again, because it feels like there's a lot there that would have value in processing here, because I think we all are doing a really nice job of it. And so, but I think, so I mean, I'm taking away the experience and the feeling and the value of this. I'm actually feeling really thankful about being able to do this, because I didn't, I don't know what I'm doing. I didn't register for things before I got here, and I didn't know I was supposed to do that. And so there were a bunch of things I'm not going to end up doing, and I was I'm missing out on some workshops that I was going to be a part of, but I got the pseudo workshop here, which was awesome. And so I didn't have to, great. I'm not going to be bitter about that when I go into the rest of the conference. And I think from a technical standpoint, I think sort of watching Francis and Sally, the two of you, the way you've intervened in different ways has really helped me to feel more confident in doing more of that intervention in the groups that I do, and being more intentional and pushing for people to talk in the moment about the feeling, about the thing that just happened, even if it was a small thing that seems like a small thing. We took anger for 45 minutes. Yep. That was very it could have been a throwaway thing, and ended up being this really big part of
Core.
it. Yeah, so that I'm really taking that away from what we've done today.
Good.
Yeah, so thank you. Oh.
I like to how the two of you are authentically yourselves. I'm moving more that way in my own practice, but when you're out there doing it all by yourself, it's is that really the right thing to be doing? But so it's really great to experience it, and it feels like the right thing.
How was it for you, Q?
I need a nap. But I want to sincerely just thank you all for this free therapy. I want to pay you after this, because there's so many things I need to address. And I just really enjoyed the experience and getting to know a piece, of you all, and share a piece of myself. And it's been a good experience. So.
Yeah, I learned a lot about, my inner voice. I learned a lot of, because I was having thoughts and feelings during the whole thing, right? I learned a lot about impression management, which is really interesting. How I come in, how I present, maybe what I'm wanting consciously or unconsciously from other people. I think a lot to play with.
Okay.
Yeah.
Do you have feedback that's negative for me and Francis, stuff that we could work on?
I think it's more of just how I run groups. I would have wanted more in the moment, here and now interventions.
Okay.
I would have liked more, less discussion support, more process orientation.
Okay. Thanks.
Yeah, that's stylistic difference.
Yeah.
Other closing thoughts, things left unsaid? Thank you all.
Yeah.
Thank you.
Thank you.
So should we have them sit down, and then we'll talk about it? And then if people have a question for one of the group members, we could bring them a mic if they want to respond to it.
Yeah. How do you guys want to do it? Do you want to just go back to your seats, or do you want to take questions from the audience? Or
I'm comfortable staying, but
Okay,
Let's stay here.
okay, we'll stay here.
I'm okay.
Yeah. Les, you want to grab a mic and help us have a discussion? Good. I appreciate it. I had a sense we'd hit it off.
So I just have some post-group debrief of the leaders if you might want to ask us. I don't want to turn that on again because it puts your head in the spotlight, which maybe we should make Michelle do. Questions for the leaders. What processes stood out to us? Did research inform our thinking, decision-making in this fishbowl demonstration, role play? Looking back, what might you do differently? Do you really think about research when you are leading a group? Some questions for the leaders, but feel free to ask whatever you want that's relevant to what we're talking about.
Okay. So I had a mix of reactions, so I'll be positive first. I really did like the group thing that occurred up there. That was phenomenal, I'll say, because I spent a lot of time in my groups, just trying to create that. So that was really good. The other part is less flattering. I'm really disappointed because I thought I was coming to see integrating research, and then I ended up with a group. So I'm not sure if I was mistaken in understanding what the seminar would be about, or if you all tricked me like a bait and switch. So that was in the vein of, I think everybody was being honest and very open about what they were feeling, and I was feeling that the entire time. Like, okay, this was a bait and switch. I did not know this was going to happen. Whereas my research, whereas the integrating of the two, I'm really upset. I'm really angry about that. So that was.
Okay, so one of the studies that I did, Gary Burlingame and I did, I'm really proud of, is we took natural helpers. We got 4 professors who'd been nominated over the last 10 years as being really good professors, but they weren't trained in mental health at all. And then we had expert group leaders, and they all ran groups. And on 22 of the 24 comparisons, they were all the same. But what the expert leaders did is they pushed. So we had MMPIs, and in the expert leader groups, the MMPIs got worse. And then at 6-month follow-up, they got a lot better. And it's because the expert group leaders knew how to push. And that stuff is in my head all the time. So I could have said that out loud. What would have helped for you? I'm giving you this back.
I think it was simply a matter of expectation.
Okay.
I expected one thing, and my image of this playing out is just completely different than what it was. I thought someone would be up front. They were talking about, this is research, this is a clinical perspective, this is how the two are integrated, and these are things that you can take back with you to improve your group process as a group leader.
Okay, maybe I can say a few things too. So I think a lot of what I did was kind of research-oriented. I wanted it to set some kind of frame and structure. I think, as we said, the importance of maybe pre-screening, and particularly group composition. If this was the right group composition or the wrong group composition, having a dual relationship would be something very seriously to consider. But I think early on we're talking about the structure of getting people engaged, the leader being more active in the early formative stages, kind of seeing if there's some kind of similarities initially to build cohesion, and then maybe slowly having differences come out. I often like to think that in our similarities, we get support in the group, and through our differences, we grow. So I was thinking...
Is there research to back that up? Is that why you're explaining that?
Sally, what's the research on that? No, yes, I think there's research about group leaders being more active, engaging, setting the stage as we move from a forming stage, setting the structure, setting the group culture, what's allowed, having a clear kind of idea of what they want the group to do, how the group would move towards these goals, building collaborative goals with the leaders, and with the other members, and then moving more into the working phase of the group. So I think that's
So that's a developmental research.
Right.
And then there's research about self-disclosure from leaders. And it has to be something that it's real, authentic, but it teaches, so it has to sort of push, but you have to be okay with it. Like, it's 20 years ago, I couldn't have talked about being a mother. I was in the middle of trying to do it. And it's a role I'd never had before, and it was the most challenging of roles I'd ever had. But I think of all the things we do, our families are critical to our mental health. And so I felt the children in here. I really wanted the children to feel okay about their parents. So I thought it was a disclosure worth making. Because I'm not in the middle of being upset about it.
I think we promoted an interactional process that's encouraged in the research, having members talk to each other, having members give each other feedback in some way, which I think people do in their theoretical orientations. That's also supported in the research.
Yeah,
I'm gonna jump in here because I think there's some anxiety in the group and maybe among the leaders about what the audience experienced and might want to fill the space a little bit. So because I think that the audience is having some reactions. So I also first want to, and I might be able to answer your question, Anthony, about the research in a different sort of way. First I want to say I felt like there was tremendous poise and really some beautiful moments that I experienced in the group. I mean, a lot of honesty, a lot of connection, and a lot of bravery under difficult circumstances. I felt like from the outset, even before the group sat down, I was experienced a kind of split-off rage from you, Sally, that made me not want to jump in, because usually I'm the first person to jump into a group, and I'm like, I'm not going. And so, and I don't know you, I've never met you, this is my second AGPA, and it's something immediately felt not kosher for me. So I want to speak to that, and that goes to the research piece. Because so I do something called feedback-informed treatment, which is research-informed, but more importantly, process-informed and client-informed group therapy, where data is continuously collected from clients about the experience, about the process, so that there is the kind of feedback process the leaders need to make adjustments. And I feel like even at the end, from my experience, I felt like the group was letting the leaders off the hook a bit too much, being kind of kind and polite in a way that I don't have to do because I'm in the audience. And so, but the point of doing feedback-informed treatment is if I give my group members a form with very specific questions and I set up a certain culture around honesty and the importance of that honesty, I'm going to get smacked. Like I'm going to sit here and smack you all a bit with love, with the sense of we all want something to be better. We all want there's something that doesn't feel safe or doesn't feel right to me, and I'm going to hit you, even if that's the way to do it, just to wake up the process or wake up the group leader. So I get hit. I had to readjust the scale just to make sure it went low enough once I started actually getting the feedback, because I was surprised how low the alliance could go in a group versus having done it in individual and couples work for about 12 years before I started doing it in group work. So I can get really low alliance scores. So I feel like I want to throw a brick in here and especially give you a hard time, Sally, because I felt like there was a kind of lack of safety I was experiencing from you, and it got sidetracked in this whole other piece with Francis and these dual relationships and things like that. But there was, even before that stuff came out, I think that feedback process. Well, I know that research shows it improves the therapy outcomes, but that sprinkled into this process might have caused more of that to erupt, a little more truth, a little more healthy combat to flush out, at least what I was experiencing as being suppressed rage. So.
You want to comment on that, Sally, at all?
I just want to understand it. So you said split off rage. Meaning I didn't allow it to be
I felt like
expressed?
it was coming out sideways. I felt like there were some comments you made from the beginning about why you did research and about sexism and about people wouldn't take you seriously as a woman, and unless you show that you're... What's that?
What was split off about it? She was
Because
pretty direct.
It felt sideways to me. It felt like instead of saying I have fear, I'm angry, or whatever was going on, I was experiencing it as comments about books or authority or something like that. And then as soon as the group started, I noticed, and I don't this will be recorded, so maybe people can look later, but I felt like there were some comments that felt, and maybe someone else will remember something specific in the audience if this is even resonant for anyone else. But it felt, I just felt a tension, and I didn't, watching this, I didn't feel safe about what was happening, what was unfolding, and whether people were going to be able to drop fully in.
But it seems to be focused on me.
Yes.
I'm going to make a couple of more general comments that I think might be helpful to the topic here and Anthony's initial question. So I think in some way, you're, without a doubt, having therapeutic alliance between the leader and the members is important. So I think in subtle ways, I think of the research that comes, that accurate attunement. You're feeling this way, or it can be verbal, it can be a nod of a head when member is speaking, or kind of even eye contact. And then also kind of the alliance, not just between the leader and the group members, but the alliance between the members and each other. So I've encouraged people to talk to each other. I encouraged Jenna and Michelle to look at each other when they spoke to each other. So trying to build that alliance across all members in some way, forming some kind of subgroups, I think, from the systems idea that may create a sense of safety that could create more risk-taking. So I think this topic of alliance is really good. And then there's always a tension, I think, between levels of safety and levels of tension. So if things are too safe, no work's getting done. And if things get too high, people start disassociating, leaving the room, and they don't have work done. So I think that's something, that kind of optimal level of performance is something I'm sure Sally and I were both thinking about, of how to push the group and not push the group too hard. So I'm trying to bring in some research ideas about it. But I really appreciated what you said, too, in your reactions.
So I thought the group was really powerful, really good job. I think sometimes it's hard for men to hear anger from women, and so I think that was playing out a little bit. I think that two of the best interventions that I saw were, Sally, when you said to Jenna, "Are you having trouble making eye contact? We're here, darling." And I think that could have been backed up by the group a little bit more to help Jenna bring back in there, because she was getting ignored in that process. But I thought that was a really nice sort of emotional intervention. And then, Francis, when you said people were talking about their professional affiliations and goals, and you said you just did a simple reminder that when people are talking, think about and react to what you're feeling and respond back. And that was beautiful.
Supported by research, Rebecca.
Supported by research, all of that.
Supported by research.
Okay. Thank you all. Thank you, group members.